Anna, good morning to you, sir. I'm sorry our Skype didn't work out, but we're glad to have you on the phone.
Thank you, Alex. Good to be with you.
Well, sir, the White House says the GOP plan is going to give millionaires an extra $200,000 tax break, while seniors have to pay an additional $6,000 out of their pockets for Medicare. Can you talk about the accuracy of those numbers, and do you think voters would support that?
I think that the voters want to see our economy improve. We also understand that when you tax small business people who actually have subchapter S's, those are the people who are hiring. The president may call it a millionaire tax, but we see it as a tax on jobs. We have to have both a growth policy as well as a cut spending policy. What the president proposes does neither.
Okay, that is big picture, sir, but those details there, $200,000 tax break, seniors paying $6,000 out of pocket for Medicare expenses, is that accurate?
That is not accurate. The way the Medicare plan, first let's put this in perspective. As baby boomers retire, there's a whole group of us, that I'm a baby boomer, that are going to go through. We had fewer children than our parents, so there are fewer people paying into the system to support us. The actuaries say that Medicare will go bankrupt by 2017. That's in 6 years it goes bankrupt. Now, the president has really proposed nothing to address this. In fact, his health care plan took $500 billion from Medicare to create his new entitlement program instead of strengthening Medicare. What Paul Ryan's budget does, it takes that $500 billion the president took from it, it reinvests it in Medicare to make it stronger. Secondly, for those who are 55 and above, nothing changes. Nothing changes. You have and those who are currently on, nothing changes. But if we don't do something for those of us who are less than 55, Medicare won't be there for those who are currently on, those who are about to be on, and it certainly won't be there for my group of people. So what Ryan does, 55 and above, everything stays the same. 54 and below, it's not a voucher. You used that term earlier. It is what is called premium support. It is what I have as a member of Congress, where I get a certain amount, as every other federal employee. The federal government contributes a certain amount to me. I put up what is appropriate, and then I purchase my insurance. In Ryan's plan, if somebody is poor, they pay nothing. If somebody is richer, if they're a millionaire, they're going to pay more.
All right, I want you to listen to something. We're going to play what President Obama said at a Chicago fundraiser, but he did not know that a microphone was recording him at the time, so let's take a listen.
Okay.
We're happy to have the debate. We'll have the debate on the floor of the Senate or the floor of the House. Put it in a separate bill. We'll call it up. And if you think you can overturn my veto, try it. But don't try to sneak this through.
Congressman, this is the president talking about the 2011 budget, of course, the battle over there, the efforts by the GOP to strip Planned Parenthood of any federal funding. Do you believe that social issues should be included in these financial debates? I mean, isn't the economic situation serious enough all by itself without adding abortion into the mix?
Well, heck, just look at, should we be paying $35 million to a private entity? I mean, $35 million. Think how many taxpayers it takes to pay for $35 million. Now, on one hand, you can look at it as a social issue, and on the other, you can say, wow, there's a lot of private health providers who are able to do the same thing. There's Medicaid funding for the same thing in some states. There's other people who can pay, the same thing, and yet we as a federal government are deciding to fund a private entity. Secondly, let me comment on the president's remarks. One, he sounded a little stressed. He's been taking heat because he's not been providing leadership on the issue. But the other thing, note that everything he said was negative. He didn't say we're going to advance a plan to control spending, to keep Medicaid from bankrupting states, to keep Medicare there for those who are on it and those who are about to be. Instead, he spoke in the passive and the negative. Now, whatever you say about the Republican plan, at least we're being honest and accountable to the American people, saying that Medicare will not be there unless we have reforms, and it will be exactly the same for those 55 and above, and it will be premium support like members of Congress get for those 54 and below, and let's debate the issue.
All right.
I don't hear his side of the debate.
Well, we should say, in all fairness, the president was not aware that he's being recorded and speaking privately, so he thought to a group of fundraisers there. And in terms of the tenor that you're speaking there.
I understand that, Alex, but there's a scripture that says that out of the overflow of the heart, the mouth doth speak. And we really want the president giving us the same sort of solutions that Republicans are advancing that give the American people a vision of how we're going to have Medicare for everybody. Well,
Representative Bill Cassidy, we thank you for weighing in, sir, from Louisiana. Thank you so much.
Thank you, Alex.
Later this morning.